You're being called in for a code red for a 70-year-old female who is in respiratory distress in a private residence.
Okay, so I'm gonna make sure I'm parked in a nice spot for entrance and exit, just due to the fact respiratory can decline really quickly. I am also going to, if there's any animals, ask for them to be put in a different room. Because it's respiratory, it could be like the flu, any infection, asthma. She's the only patient and it's just me, so no backup. And my PPE, I'm gonna don my full N95 eyewear, gown, and gloves due to the fact the positive fried. As walking in, this is what I see.
Yeah, it's okay.
So she's clearly in distress as well. She's tracking me, her eyes are moving around, and she's consolable as her dad is just talking her down as she's breathing really quickly. She seems to have, it was hard to see in the video, but there was substernal retraction as well as stridor on inspiration. Her skin looks good, like she looks warm, and she doesn't look too sweaty or anything, but it looks like she's circulating well.
Just okay. Okay.
Walking in. Hi, I'm Annie. I'm a paramedic.
Hi.
What's your name?
Andrea.
Okay, Andrea, can you tell me what's going on here?
Okay, yeah, so Sarah she's starting to have this really bad cough about like last night.
Okay.
But to date was really bad. Like the
Okay.
sound that she's making.
Yeah. Hi there, Sarah. I'm Annie. Can you tell me how old you are?
I'm 7 years old.
Okay, Sarah. And do you know where you are right now?
I don't.
Okay, I know this is scary, but can you tell me? Do you know what time it is?
It's like night.
Okay, Mom, can you just stay right here? Keep
Yeah.
just making sure.
It's okay, baby.
We're gonna try to figure out what's going on. I'm just going to take a look in your mouth. I want to see if that's all right. Do you wanna click it at all? Are you okay?
Yeah.
Okay. Okay, can you open up for me? Okay, I'm looking for any obstructions. The airway seems to be clear.
It's a little bit swelling.
There's a little bit of swelling.
Yeah,
Okay.
but it's cleared.
Okay, and I'm noting any facial droop or slurred speech.
None.
Okay, and then I'm just looking at her neck. Is her trachea midline?
Yeah, but there's like this tugging.
There's tugging.
Yeah.
Is there any JVD?
No, not
Okay.
yet.
Now, Sarah, I just want to take a listen to your lungs and check around. Have you ever seen one of these before?
No.
No? Okay, do you want to feel it?
Yeah.
Okay. It's going to be a little cold, but I want to put this on your chest so I can listen to hear what's going on in there while you breathe, okay?
Okay.
Okay, so I'm going to also take.
Okay.
Okay, so take a deep breath in. Okay, I know it hurts. One more. Okay, and one more. And one more. Okay, you did really good. That was perfect. Was air entry equal on each side bilateral?
It was
Okay.
bilateral.
And was did I hear any wheezing?
Yes.
Crackles?
Yes, very much a lot of wheezing in all four.
Okay.
Mm-hmm.
What was the rate and the volume?
She's breathing extremely fast and like working hard for it.
Okay. Now, Sarah, I just want to feel your chest for a second. I want to just check to see if there's anything going on. Is that all right?
Yeah.
That's okay?
Mhm.
Okay, so I'm feeling for any subcutaneous emphysema.
There's none.
Okay. Now, Sarah, can I see your hand for a second? I want to feel your brachial pulse.
Yep.
But just feel on your heart. Okay.
Mm-hmm.
What is the approximate rate, volume, and strength?
You're feeling about, it's regular strong, it's about 2 per second.
2 per second. Okay. Now I just want to squeeze your finger. You got a favorite finger? Is that all right? It won't
Yeah,
hurt.
this one.
Okay, perfect. And how's the cap refill?
Yeah, it's perfect.
Okay, now Sarah, I just want to take a look at your legs for a quick second. Is that all right?
Mm-hmm.
Okay, you're doing so good. I know it hurts, okay? Any peripheral edema?
No.
Okay. Now, I know this is really scary, Mom,
Yeah.
but what it seems to be, have you heard of croup before?
No.
Okay,
Is that a cold?
What it pretty much is swelling in her
Okay.
airway.
Okay.
So it's what's causing the weird noise when she's coughing and
Okay.
breathing, okay?
Okay.
But for that, I just need to know, does she have, well, I ask you these questions, I just want to take some of use some fun gadgets on you, all right, Emily, if that's all right?
Okay, we need this, okay?
Yeah. Okay. Does Emily have any allergies?
Yeah, she's allergic to strawberries.
She's allergic to strawberries, that's it?
Yeah, that's it, yeah.
Okay, now Emily, do you got a favorite finger?
Yeah, this one.
Okay, I'm just gonna put this on there. Okay, this is gonna tell us how well your breathing's doing, okay?
Mm-hmm.
Now, does she take any medication?
No.
Okay, and does she have a past history of like anything similar to this?
No, not a thing
Think
of
of? Okay, and do you know when she last ate?
Yeah, and last night before we went to bed.
Last night, okay.
Mm.
And do you know what was like occurring before this? Do you know what caused it? Anything that brought it on?
So she had like a cold at school like 2 days ago, and then like 2 days ago, and then this today, well, we're at the night right now, she started to cough worse, and then during the middle of the night, she kind of woke up and she was really just making that noise, and that was not normal.
Okay, well, what seems like there's a medication. Have you heard of epinephrine?
Is it not for allergies?
Yes, but this is another use for it. It's just
Okay.
gonna really help. So I'm
Okay.
thinking we can give her some of that. Just there's been no known allergies to it.
Mm-hmm.
Okay, perfect. So I think we're gonna do that.
Okay.
But first, I just want to take your temperature. All right. So have you seen this before?
Mm-hmm.
Okay. So is it all right if I do it?
Yeah.
You understand? Okay. Perfect. Okay, and it does seem she's running a little hot.
Yeah, she's 32.2.
32.
38, sorry, 38.2.
Okay, now have you ever had your blood pressure taken?
No.
Don't know what it is?
No.
Is it okay if I do it?
Is it gonna hurt?
It's gonna feel like a nice little hug to your arm,
Oh,
okay?
I love hugs.
Okay. Now, do you want to hold this for me?
Yeah.
Okay, perfect. So I'm just gonna wrap this around your arm. Oh, okay.
This is a peds
Yeah,
blood
it's,
pressure.
it's sized.
It's sized correctly.
Yes, to the.
Yeah, of course.
Oh my goodness. You're doing so good. Don't worry. We're gonna get you some medicine, okay? Now I'm just gonna squeeze this up to 160 or 180,
Mm-hmm.
and then we're gonna slowly just let it out, listening. Okay, what's the blood pressure read?
130 over 90.
You did so good, Emily. Sorry, what did you say?
130 over 90.
Okay. Now, Emily, have you ever received any medication before?
I take my vitamins. Mommy says
Vitamins?
it's good.
Okay. Well, this here, your medicine, I'm just gonna put it in here. 2.5 milligrams of epinephrine. We're gonna put it in there. We're gonna shut this. So this is the stuff that's gonna make you feel better. Okay. Now this is a little scary, I know,
Yeah.
but it's gonna start blowing out. We're gonna connect it to oxygen. This is oxygen over here. It's gonna start steaming. Okay. This is scary, or how are you feeling? Okay. Now, it's gonna blow in your face. I can do it, or you can feel it. If you want to feel it, if you want on your hand, you can. There you go. Okay. And I just want to hold this up to your face, and we're gonna put it on. Mom can help too if you'd like that.
Yeah.
This all right? Okay. Perfect. Now you're doing great. It's gonna make you feel better. How is it? It's feeling better. Okay. Is it okay if we put it on?
Yeah.
Okay.
Sorry, I
so
don't know
we're
how to do that. Sorry.
You did good. Do you wanna? Can you wanna?
Yeah, I
Yeah.
can. Is that enough? I'm so sorry, paramedic.
You're doing great. This fit?
Yeah.
Okay. There we go. Perfect. And sorry about. I'm just trying to knock it on your eyes a little bit. Okay. There you go, Emily. You're doing great. I know this is. I'm really hoping you're feeling better. Okay, so Mom, I think we should take her to the hospital. This is
Okay.
pretty urgent.
Okay.
You're allowed to come in the ambulance.
Yes,
it
can
would
I?
be better, you know. I don't want her to be scared or anything.
Okay.
We're gonna be there for you the whole time.
Oh.
Okay, and we're gonna transport her with PD plus.
Okay.
Transport thing just so she fits on the stretcher better. PD mate plus, and then we are gonna go to CHIO. You know where that is?
Yeah.
Okay, so we're gonna go there. And they're gonna help her out.
Okay, perfect.
This is unit number 123, paramedic number 321. I have a C-Test 2 pediatric patient en route. Do you have a minute for a patch? I have a 7-year-old female experiencing moderate to severe respiratory distress due to suspected croup. She has stridor on inspiration, substernal retraction, swelling of the airway, and shallow labored breathing. Air entry is equal bilaterally, and she has swelling in all 4 quadrants. She is currently tachypnic with a heart rate of 120 and a temp of 38.2 degrees Celsius measured via infrared air. The patient has no past medical history, but she developed a cold 2 days ago, followed by a barking cough and stridor tonight. Last oral intake was dinner 5 hours ago, and she has a known allergy to strawberries, but no known exposure today. On scene, the patient was in moderate respiratory distress with stridor and increased work of breathing. Due to worsening symptoms, 2.5 milligrams of epinephrine was administered via non-rebreather. Following her treatment, her respiratory effort improved, but stridor is still present. She was placed in an upright position in the ambulance, which has helped with her breathing, and she is currently on oxygen at 5 liters per minute, maintaining an SpO2 of 96%. We are currently 6 minutes out from your facility. Patient remains alert but anxious. Do you have any further orders or requests before arrival? No? Okay.